I'm Dr. Amanda. I'm an orthodontist and CEO of StraightSmile Solutions. We help dentists understand orthodontics better. This video will share an excerpt from a webinar hosted by Clue Dental Marketing and Dr. Llanes of Modern Essence Dentistry. Any patient photos are the property of Modern Essence Dentistry. If you have questions, please reach out at www.cluedentalmarketing.com. If you have questions about orthodontics, please visit StraightSmile Solutions at www.straightsmilesolutions.com. Enjoy the video.
Okay, so what I want to talk about this pre-phase one with I call appliance therapy. This is something that you can do before phase one. And I want to go through a case here. Patient is age 6. She has a very narrow arch. As you can see the crossbites here. Right, and so we use a biotrainer, UConcept biotrainer, and what we did here is that she wears it at night, and we put some bite bumps to help jump the bite, and then I'm going to show you the results here. You can tell here after about a year of using it, just sleeping with it, it made a wonderful jump over here, and you can see that the arch has expanded. And I didn't really do much to just let them wear that appliance, and you can see the results. It's really helpful, especially when they're younger. They're not going to suck their thumb at night. They're going to just sleep with this appliance, and you can see that it has a nice result. Okay, so next is I'm going to talk about a little bit for first phase. And here's my case, 10 years old, male, mild crowding. Here we have a vaulted maxilla, and we have a deficiency here, severe deep bite. We got a mild class 2 as well. And here's my treatment plan. We actually use removable expanders with anterior bite plate. We bracket 7, 8, 9, 10. And for molars, we estimated treatment time to 12 to 18 months. And then we're going to retain until phase 2. Here is the panoramics when we were just monitoring him. We can see that there's actually a supernumerary here, and we got that extracted. And here we're concerned because the canines were blocked out. We really need to intervene sooner. So here is the appliance. You can just see here the patient's going to wear this all the time except brushing their teeth and eating. And then we're going to turn once a week, and we can show you how we turn that. Dr. Mann can talk to you more about that. Here is the analysis after just using the expanders. Intra-arch was 39 millimeters, and we were able to widen the arch both upper and lower. You can see that a great significant difference here where we can allow the teeth to come in straight. Here I'm going to go through some progression. Got the braces on, sectional wire. Teeth are getting straighter, try to close the gaps to help with aesthetics. It opened up because we are trying to align the roots. And then we close it again. We under-tie it, and then the finished result. Okay, so we are going to go through the progression of the pano. So it's really great to have a pano in your office. Here blocked out, you can see that the canines are coming down. We actually did a lingual retainer to just make sure that the teeth are going to come out straight because they're kind of late a little bit. And then here close to the final finish, that the canines are nicely down, and the teeth are nice and straight. And here is the finish of phase 1. I use a lingual retainer here just to keep the front teeth here. You can tell that the teeth look much better. Their midlines are on, and we're waiting for phase 2 when the second molars come in, and then we can work on closing the gaps and fixing the bite. Okay, my next case is dealing with traditional braces. Here's a comprehensive case. Patient's 12 years old. He has moderate crowding, a deep bite, class 2, division 2, subdivision right here, and then class 1 on the left side here. So you can see here, definitely crowding here, both upper and lower. And the thing to note here is that I did not use expansion on this. Well, like a removal or fixed expander, I actually just did braces with him. Here's the Ceph convex profile indicating class 2. Nothing out of the ordinary in his panoramic, so nothing impacted. Here's the treatment plan. We're gonna bracket molar to molar, first molar, upper and lower. We're gonna put some anterior bite ramps to correct the deep bite. I'll show you what that looks like. Box elastics to level the curvus V. And then on the right side, you're gonna see me move the teeth easily to correct the class 2. And we estimate about 12 to 18 months with this case. All right, so here with the initial bracketing, I do not use the indirect bonding system. I actually place them manually. Right here, we place the brackets. We have a nice light wire, and then you're gonna be pretty amazed what happens after a couple months. Okay, so the teeth are already straightening out after 2 months, but you can see that the bite does not work. And I'm gonna show you that the bite is propped up with some bite bumps here. Here are the box elastics to help seat the bite. After about 9 months, we got the bite to close here. So we're working on mutualizing each molar. You can tell from 9 months to a year and 7 months that this procedure actually takes a while because we want to move it slowly. We don't want to damage the root. All right, I'm going to go through some progression slides here. Here are the turbo bites. And then you can see here a little bit oval arch. When we get to a higher wire, the arch is a nice round arch, and then finish. Okay, so here we corrected the class 1, the class 2 to class 1 here. The midlines are on, nice round arches, and then we retained it with a fixed upper and lower retainer. Oh, just one thing to note with the retainers, in dental school, I hate bending wire. So this is actually prefabricated. The laboratory has a jig that they set up. So all we do is just put the jig on and then put composite on the pads and cure it. So that saves a lot of time. Okay, and clear aligner, Dr. Manna talked a lot about clear aligners. Here's just, I think every dentist should be doing clear aligners, whatever system you like to choose. This is just, if you haven't done any, take a nice diastema case or crowded case. Here, class 1, got some upper diastema, it's mild crowding on the bottom. With clear aligners, with Invisalign, they place attachments here, so we just follow their plan. It estimates about 30 trays total, and we change out the trays every 7 days. Okay, so this is month 2. We're just here progression, making sure that they're tracking. Patient is actually pretty comfortable, and they were very compliant, so it made the case a lot easier. Okay, and here's the finish. Same thing, spaces are closed. The bite didn't change here, and nice round arches, and patient was very, very happy. Okay, so before and after, and then I do clear aligners. What they do in Invisalign, they usually don't want that wire in the back, but sometimes I do. If it's a very, very crowded case, and then we did some Vivera clear retainers. And the nice thing with that is it comes in 4 sets. So in case they lose one or they wear out, they have extra.